Today, we're diving into a really strange paradox that's kind of hidden in the world of medicine. You see, when it comes to malpractice lawsuits, the doctors who treat children, well, they get sued the least. But, and this is the twist, they face some of the absolute biggest financial risks in the entire field. So let's figure out why.
And this slide gets right to the heart of it. In adult medicine, you see a higher frequency of lawsuits. It's just a more common risk. But in pediatrics, it's the complete opposite. Lawsuits are pretty rare, but when they do happen, the financial payouts can be absolutely staggering. This creates a really unique and honestly an incredibly challenging environment for the people caring for our youngest patients.
So what's really driving this wild imbalance? Why are these pediatric cases such massive financial outliers? And maybe more importantly, how in the world do doctors manage the pressure of working in a field where the stakes are just so incredibly high? Let's break it down.
Okay, so to understand why these cases can become so financially explosive, we need to look at a few key factors. It's really a perfect storm of legal, medical, and, deeply emotional elements that all come together to create this uniquely challenging situation. The single biggest driver behind these massive payouts is actually pretty simple, but it's incredibly powerful: a child's long life expectancy. Think about it. If a child suffers a serious, lifelong injury, the legal system has to calculate the cost of that injury over their entire lifetime, which could easily be 80 years or even more. And when we talk about lifetime damages, we're not just talking about a one-time payment. This has to cover everything. We're talking about the projected cost of medical care for decades, specialized support for lifelong disability, and the loss of all the money they could have earned in their life. When you project all of those costs over a full lifetime, the numbers just become astronomical. But, it goes way beyond just the financial calculations. Pediatrics has some truly unique challenges. A baby can't tell you, hey, the pain is right here. It makes diagnosis a really difficult puzzle. And then there's the emotional toll. The harm of a child's injury is just immense, and that creates this powerful resonance with both the family and, of course, a jury. And on top of all that, some conditions like meningitis are like medical time bombs, where literally every single minute counts. So, in this incredibly high-risk world, how do pediatricians protect their patients and, frankly, protect themselves? Well, they rely on what you could call a defensive toolkit, a set of core strategies designed to navigate these exact challenges. It really all boils down to three key pillars. First, communication that is consistently clear and compassionate. Second, meticulous documentation that tells the whole story, leaving zero room for doubt. And third, this proactive approach they call safety netting, which is all about empowering parents to be active partners in their child's care. And this right here is such a critical insight. The decision to sue often comes down to pure emotion, not just the medical facts. It's less about the mistake itself and more about how a family felt they were treated. When a family feels heard and valued and respected, even when there's a bad outcome, they are far less likely to file a lawsuit. In this field, communication really is everything. This is a perfect example of that safety netting idea in action. Notice it's not some vague advice like, come back if it gets worse. No, it's a specific set of clear, actionable instructions for a parent who might be worried about something like appendicitis. This turns the parent into an informed partner and provides a vital safety net if the situation changes. All right, now we get to what is arguably the most difficult situation a pediatrician can ever face, when a parent or guardian refuses necessary medical care for their child. This is where medicine, ethics, and the law all collide head-on. This is the ultimate balancing act. A doctor has this profound responsibility to protect the child, but they also have to respect the rights of the parents. So what happens when those two sacred duties are in direct conflict with each other? The very first thing to recognize is that not all refusals are created equal. I mean, a parent declining a routine flu shot? That's typically a pretty low-stakes situation. But a parent refusing an ER visit for a kid with clear signs of something like meningitis? That is a high-risk crisis. The potential for imminent, serious harm? That's the critical difference. So how does a doctor figure out when a refusal crosses that line into potential neglect? Well, it's not a gut feeling. It's a careful, methodical process. They ask a series of critical questions. Is the condition serious? Is the recommended care just standard practice? Do the parents really understand the risks of saying no? And the most important one,
Is the child at significant risk of harm because of this refusal? If the answers start pointing to yes, the doctor has an ethical and legal obligation to escalate. In these situations, the documentation becomes incredibly precise, and it carries immense legal weight. This is not casual language. Phrases like risk of significant harm and child protection consultation are legal and ethical tripwires. They are documented signals reserved for when a critical line has been crossed and the child's safety has to take precedence over everything else.
So, after exploring this really complex issue, let's just recap the key takeaways.
So here are the crucial points to remember. First, the paradox itself. Pediatric lawsuits are rare but financially severe, all because of those lifetime damage calculations. Second, the defensive toolkit. A doctor's best protection isn't a team of lawyers, but actually excellent communication, documentation, and safety netting. And finally, when a caregiver says no, a calm, systematic approach is absolutely essential to protect the child.
And all of this really brings us to a much deeper, more challenging question. The systems we have in place are designed to manage risk and protect kids, but they also expose this constant inherent tension between parental rights and a child's welfare. And in those toughest moments, figuring out how we can best protect the most vulnerable among us, well, that remains one of the greatest challenges in all of medicine.